And the next presentation, I believe, will be very interesting because it generated a lively discussion and a lot of questions on the last Radon annual meeting in Ustron. If you remember, it was a part of ethical training. So let's see if I see the slides are ready. So the topic of the coming presentation is perception, frames, and understanding of radon in German, Austrian, and Czech radon spas. And out of the whole, our so-called radon spas team, this will be presented by those who did most of the research, which are Clara Himmelbauer from AGES and Robert Geismans from SCK. Sand, the floor is yours.
Thank you, Peter. So yeah, as was announced, maybe a bit of a more exotic exposure situation. So we'll be talking about the presence of radon in radon spas, and particularly how this presence is being perceived by and communicated by and also enacted by stakeholders of these radon spas.
Thanks, Robert. So with the first slide, we want to show that this potential controversy may arise, as radon is used in radon spas for therapies on the one side, but on the other hand, we have, of course, a lot of regulations to protect from radon, as it is one of the main causes for lung cancer. So what we see on the left map of Europe is those countries that are colored in light green. Those actually have radon spas. So what are the spas? Those are facilities that offer treatments, therapies, services that claim beneficial effects of radon on health and on well-being. And most of those spas, they have actually well-established histories and positions, and as you have seen, they occur in various European countries. So, but on the other hand, we have the national radon action plans, and we've heard about them today, which have the main aim to reduce radon exposure. And we see on the right map of Europe, in all those countries that are colored strong greens or dark green, they already have implemented the national radon action plans, and this status was in the year 2023. So what we do see here is that there is an overlap of those countries that have implemented the radon action plans, and some of those countries have at the same time radon spas. So this is why we were interested to investigate and address those potential controversy between radon as a treatment on the one hand and radon as a threat on the other hand. We tried to focus on the perceptions, the representations, and also on enactments of radon in those radon spas. So we wanted to see how is radon perceived, enacted, and presented by the radon spas by themselves, but also we were interested to see how is radon in those spas perceived by the general public. This is a first-of-a-kind study, and we used a mixed method approach. So we used both qualitative and quantitative data and analysis, and we applied it in various countries. We just want to mention here that it was not our objective to assess any radon concentrations, doses, or health effects. Just to dive a little bit more into our mixed methods approach, first we tried to take a look on the web pages of those spas. So how do they present and how do they communicate about radon? And therefore we started to do a framing analysis of the spa web pages first, and then we tried to go a little more into it, and we wanted to know how is radon perceived and acted by the spa employees. Therefore, we did some semi-structured interviews in Austria and in Germany with the spa employees and management. And the last part of the study was computer-assisted web interviews. So this actually was part of the Radon European Behavioral Atlas, which we just heard from Melissa before us. The idea here was to get to see how radon in the spas is perceived by the general public.
Thank you. So as Clara just said, in our first sub-study, we actually conducted the framing analysis. We looked at actually how is radon being communicated about by these radon spas on their websites. Those not familiar with framing, well, framing basically is a concept from communication studies which state that in our communication, there are certain aspects of reality which are being highlighted, other aspects which are being downplayed potentially, which creates certain potential perceptions of this reality. So to give an example, you can, in a newspaper, for example, find articles which are reporting on an event which states that, well, freedom fighters have conducted an attack on a certain city, or you can, on the same event, have reports which state, well, terrorists have conducted an attack in a certain city. And this can be reporting on the same event, but the way in which it's being framed, so what is being emphasized, the terminology which is being used, creates a certain perception, a certain reality about what actually happened. And that's actually what we were interested here in regard to these radon spas. How they're actually framing radon? What kind of realities are they putting forward with regard to radon? I will not really delve into the methodology too deep because we really lack the time here to go in every detail. Just to let you know that we did a two-phased approach in which we had different coders actually looking at the websites of in total 26 radon spas, which are spread across Europe. And what we found is that we see 5 main dominant frames emerging on these spas. So 5 different ways in which radon is actually being presented to the general public, which can visit these websites. The first frame, which was the most dominant one, could actually be found on all of the websites that we analyzed, presents radon really as a source of health. So here the emphasis is put on radon being a potential, well, remedy, cure, treatment that you can use for certain diseases, certain symptoms, certain complaints. And this frame was being put forward or supported as well by visuals such as a kind of medical context of people in medical clothing, people sitting in doctors' cabinets, a very prominent frame. A second frame presented radon as a natural gas, which it of course also is, but there the emphasis was really put on these natural characteristics of radon. So kind of contrasting it as well with potential chemical painkillers or medicines that could be used. Here the emphasis was really put on natural origins, natural characteristics. A third frame presented radon as a risk, but at the same time also as a non-risk. So what was quite interesting here is that on some of these websites, there were references made to the potential health risks that radon can pose by, for example, stating that some population groups cannot visit these radon spas. Minors, for example, pregnant women, people who had just had cancer treatments, they are actually excluded from these radon treatments. But at the same time, these risks were also at the same time, well, kind of comforted, minimized, controlled by making reference to the fact that, yeah, but we are making sure that whenever you are actually visiting us, there's no risk that you are posing yourself to because we are controlling the risk. A fourth frame then presents radon as what we termed an affordable luxury, which is quite an interesting one because here the emphasis is put on actually radon being something unique, something which is scarce, something for which you actually need to travel to the radon spa to expose yourself to it. It's really something that you can indulge yourself in, let's say, in these facilities. And then the fifth frame presents radon as a source of youth. So you could argue that it goes a step further than this source of health, by stating that it not only can heal you from certain conditions or can be a cure for certain conditions, but can actually really rejuvenate you. It's really kind of something which regenerates cells, which rejuvenates your body. So a frame which is also visually supported by a lot of pictures of quite young people that we see on the websites of these radon spas. So what you see here is, if you look at this first sub-study and this framing of radon, is that a quite different radon reality seems to be emerging, because when in normal health communication we talk about radon, we tend to think about radon as an indoor pollutant, not necessarily really as a natural gas. We tend to think about it as a source of potential health risks, not as a source of health benefits. We tend to think about it as something which is actually omnipresent, which can threaten you at your home, at your workplace, not something which is a luxury that is scarce and that you need to travel to a specific spa. So quite a different reality which emerges there. And then we took this and we took it a step further, and we actually were interested in how is then this radon actually also being perceived and enacted at these radon spas by the people working within these spas and the owners of the spas. So we conducted semi-structured interviews with different stakeholder groups, and here I will be particularly then talking, as I said, with the stakeholder group of the spa employees, the managers, the owners of these spas. With which we conducted 11 interviews last summer with a research assistant who could actually conduct this in the native language of the respondents, which was German, because we did this in Germany and in Austria, both face-to-face, on telephone, and online. What we saw there is that, first of all, when we talked with these radon spa employees and owners and managers about, well, what is this spa actually? We saw that first and foremost, they considered these places as spaces of treatment rather than leisure. So we use this term spa, which has a certain idea of being a leisure place, a place for relaxation, for indulgence. And They do see it to a certain extent as such, because they say, well, it's actually very comfortable to come here. It's very nice to take these kind of treatments. It's less invasive than a lot of other treatments that you could take for the conditions that you expose yourself to, or that you have, or that you're suffering from. But we are first and foremost a kind of a medical facility. That's how they receive them spas first and foremost. They also present them as unique facilities, unique in a sense of being different than other medical treatment centers, but also unique in terms of, well, some kind of an internal competition between the spas. So one spa saying, yeah, but what we offer is actually better than what the other spa in the other country is offering, or it's different from what the other spa is offering, or it's something which you can only really find here. So that's the reason why you should come here. And then what was quite interesting is that these spas are often offering a variety of treatments. Some are offering more inhalation therapies. For others, it's more bathing and different types of baths. And there seems to also be, building on this potential competition, some kind of discussion or different perceptions among the spa employees and managers in terms of the let's say, effectiveness of these treatments. So very often they say, yeah, but what we are offering here, this is actually proven effective. What the other spas are offering, we don't really know whether it's effective or not. Actually, we have our doubts, for example, whether these radon baths really do a lot to, it should be inhalation. So this kind of discussions also emerged. We then talked with them about, well, how are they actually perceiving radon? And we first asked, well, could you describe maybe to us, well, what radon means to you? And could you describe it as if you need to describe it to someone who has never heard of radon? What was quite interesting there is that many people there immediately start to say, well, actually, I'm not really a radon expert. So I know a bit about radon, or I know about it in the kind of the confines of what I should know given my professional background, but I'm not really an expert. I'm not necessarily someone who knows a lot about radon. So that was interesting, was their kind of self-reported knowledge as being limited, although we did see that then in their descriptions of radon, they did provide quite elaborate understandings of it. In these descriptions, what was really put forward first and foremost, and which matches with this idea of this dominant frame of radon as a source of health, is that radon is really being presented as something which is beneficial to your health. So the emphasis was really put on the potential health benefits of radon in the context of particularly chronic pain and inflammatory pain, but also in a range of other potential symptoms or conditions, ranging from menstrual problems to skin care to nasal polyps. These were all issues which are being mentioned in the interviews as things for which people could expose themselves to radon to and actually benefit from it. The justification for putting the emphasis on these health benefits was found in kind of three different motivations or rationales. So first of all, people refer to, well, actually, yeah, we have been doing this for quite a while and there's a high success rate. So we know a lot of people, and not a lot of our clients, a lot of the people visiting us, they actually have good experiences with it. And then they give percentage of 80%, 90%, 95%, 99% of people visiting actually have benefits from this. So that's the perception of a very high success rate. They also refer to kind of a history of radon spas as being proven facilities. So, and it's quite interesting because it contrasts maybe a bit to what we heard in the first presentation of today, in which it was mentioned that there was a reference to the Yakimov disease and how people already in the past, before the discovery of radon, seemed to experience potential health risks of radon. What we actually saw here is that the radon spas themselves say, yeah, actually, before radon was discovered, people here in the region already knew that it actually had health benefits, because the miners here, they did not suffer from certain conditions that other people or other miners had in other places. For example, in terms of back pains and these kind of conditions. So more historical kind of motivation. And then the third justification for presenting radon as having health benefits was found in science. And this was the most interesting one because it was also disputed among our respondents. So some respondents very clearly stated, yeah, this has been scientifically proven. We have data, we have studies, we have double-blind studies which actually show that radon has these kind of health benefits, while others in other spas basically said, yeah, actually at the moment we lack this kind of data. There is no double-blind study, we lack clear studies which show this. So it's a bit of a disputed item as well. What was much less emphasized in the interviews was the potential health risks that radon could actually bring. So some respondents clearly were skeptical about the potential existence of radon health risks. Some stated, well, there's actually no real proof of radon being risky for your health, something which is detrimental for your health. Others did recognize the potential risk of radon, but not in the context of their spas, because in the spa, they stated, well, this is really a very controlled substance, a very controlled matter. And This control is shown in different aspects. There's medical checks and follow-up. There is a limitation to how long you can actually spend in these spas. There's a limitation to who can actually enter them. And there the emphasis is then put on maximizing the benefit and minimizing the risk. So what kind of surfaced in a lot of the interviews that we conducted was this one sentence of, well, it is the dose that makes the poison. And with every kind of substance that you use for your health, if you use it too much, it can become a poison. That was kind of the terminology that they used, this one sentence of the dose making the poison. References were there, for example, also made to sports, stating, yeah, but if you sport too much, it's also not good for your health. So if you expose yourself to too much radon, it's also not good for your health, but it's not the risk that you pose yourself to here at our radon spa.
So, and the last phase of our study, so we were interested about the general public. How is radon perceived in a radon spas from general public? It is the radon spa survey, which was carried out in Austria and Germany and Czech Republic, was part of the Radon European Radon Behavioral Atlas. And what is important here, for Austria and for Germany, the respondents were randomly selected from out of a panel. In Czech Republic, on the other side, the respondents were participants out of a national measurement campaign, of a national survey. So we have to keep this in mind when we compare our results later on. The survey was computer-assisted web interviews, and the data were collected between May 2023 and March 2024. So this is just to give you an overview. So it was quite a huge questionnaire. It's put in a broader context, and all those items that are red behind me, they were included in our radon spa survey. So, for example, we were interested to ask about or to analyze the risk perception, the confidence in authorities for risk management, also about radon awareness or radon knowledge. And then we had a few specific radon spa related questions to get an idea about attitude towards radon spas, but also about risk perception of radon in the spas, and also we were interested in the confidence in authorities to protect from potential risks. So let's continue with our results. When they were asked, have you ever heard anything about radon? We see that there was quite a high share of respondents that have never heard about radon. It's around 40% in Austria, 54% in Germany, and even 20% in Czech Republic, which is interesting because they are actually part of a radon measurement campaign. So actually they should be in touch with radon at least once before. They should have heard about it. So out of those respondents that actually have heard about radon before, we asked them 11 items to test their knowledge. So what do they actually know about radon? And important, so those are the items which you can see on the left side. This is an example from Germany. And important here is that in green we see the correct answers, and in yellow and gray we see the incorrect answers or the I don't know answers. So we asked things like radon is a radioactive liquid, or radon causes headaches. And what we see here is that there is a lot of yellow and gray answers. So a lot of incorrect or I don't know answers. So respondents that actually stated that they do know something about radon, they have a relatively low overall knowledge about radon. Then we thought like, okay, maybe many respondents are not living in those radon priority areas because we assume that maybe they are more aware of radon. Then we tried to split our respondents into 3 groups according to the radon area where they live. So if they are living in the high radon area, in radon for Austria, this would be the radon protection area, or if they would live in the medium radon area, or if they would live in a low radon area. And here we see an example. This is from Austria, and it was also interesting to actually see that there is no difference in knowledge between respondents if they are living in radon priority areas and those who are not. So in general, we see that radon risk perception is rather low in all countries. It is seen as less risky, so radon is seen as less risky compared to other radiological hazards, such as nuclear waste or accidents at nuclear installations. And we also found out that it's important how radon is framed. So if you put it in a context, for example, with indoor air pollution or any other context, this is important too. So yeah, I'll try to be a little faster. If we ask about the respondents, so So the share of the respondents that actually know something about radon or they have heard about radon is a little low. As we heard before, it's around 40% in Austria, around 50% in Germany, and 80% in Czech Republic. So we then asked them if they could describe what they have heard about radon. And then we got answers like, okay, radon causes cancer, radon is dangerous. And we used the filter, so only those respondents that actually said that they do know something about radon, then they were put forwarded to the radon sparse survey questions. So we asked them how many respondents have heard, if they have heard about radon sparse, and out of those, so again, we used to filter only those that have heard about radon sparse before. We wanted to know about the radon sparse perception. And this is interesting because then they said things like, yeah, it is used as in sparse as a treatment, and there are some healing properties, and in general, a positive perception. So, but it's interesting here that those are the same respondents that first were asked about radon, and then they said, okay, it causes cancer. And then in the end of the questionnaire, when we asked about radon sparse, then they are talking about healing properties of radon. So we see that's actually two different things, two different realities from within the same respondents. Here we have just two questions from the radon sparse questionnaire, so two statements basically. On the left side we have radon relieves symptoms of some diseases, and on the right side we see radon has healing powers. We have our 3 countries, and the last line shows results combined together. So we see here a lot of gray within the answers, which is again the I don't know answer category. And out of those respondents that do have an opinion, we see here there's a lot of orange and strong yellow, which is that they actually agree, or some of them even strongly agree to those statements. And this was interesting to see when we matched the questionnaire results here with the framing analysis. Then we actually found that the frames that were identified on the web pages, they are also somehow reflected in the public opinion here. This brings us to the last slide of the results. We see here now a bubble chart, a bubble diagram about how well different radon stakeholders are known among the respondents. So the bigger the bubble, the better they are known by the respondents. For example, the blue bubble is the Federal Office for Radiation Protection. On the left side, the bigger one, it is about doctors and public health authorities, a little more down. And we also see on the y-axis the mean truthfulness. So are they telling the truth about radon risks? And we also see in this graph if they are perceived competent. This is what we see on the x-axis. So what we point out within this chart is circled in red. It's about the radon sparse management, that actually they are generally perceived as less trustworthy than any other actors. And this is not only for Germany, this is example from Germany, this is also for the other countries. And interesting is on the bar chart on the right side, they were asked about confidence in authorities to be protected from different radiological risks. And what we found here is that people have highest confidence in authorities to protect the visitors of the spas against potential risks from radon. So this brings us to the conclusion.
We will be very short here. So we started from this idea that maybe we'll find different perceptions about radon when we look at radon spas and radon health communication. But actually what we see is that two entirely different realities seem to be popping up above radon as a threat, and then radon as something which you find in these spas and which is actually good. And of course, there's also this potential conflation of these two different realities in the practice and the enactments of the radon spas in areas in which you have also just radon-prone areas, does pose challenges also in terms of radon risk communication. How, as a health authority, for example, are you dealing with the presence of these two potential realities? To what extent are you also recognizing the presence and the potential role and the potential impacts of these radon spas in your health communication?
And of course, we have some opportunities for future research. It would be interesting to shift the focus more towards clients, because this was not part of our study, or it was not so easy to be part of our study before. And it would be interesting to incorporate ethnographic research and also include other country context. So, but of course, we have to keep in mind that there are a lot of limitations and challenges of this study. So with this, I think, thank you for your attention.
Thank you very much, Clara and Robert. I'll double check our work package leader, Tanya. Can we do questions, yeah? We are a little bit behind the schedule. Just wanted to double check. So I see there's a question in the audience.
Thank you very much. I must admit that I'm surprised that you're surprised with the results. And I'm surprised that you didn't upfront interview patients. Because what one could put your study in a different, let's say, scheme and say, look at radiotherapy for cancer treatment. Now we know that radiation is a carcinogen, and we protect radiation. I mean, look at BFS; it's dealing with, and it's setting. We have BSS, and we are setting limits, and yet 50% of all cancer patients receive radiotherapy. This is crazy. We are killing them, and we know that radiotherapy is inducing cancer. So what are we? Look, it's exactly the same what you're doing. Of course, the problem is justification. So we know that radon works in medicine. There are studies that show this, and we will not go into details of this. So there is a justification to send people who have autoimmune diseases for radon treatment. And of course, they will see the risks differently because they're ill and they want to be cured. So I'm confused with the conclusions, and I'm surprised that you're surprised at the conclusions, because depending on who you ask, of course you get different answers. I mean, what's the alternative to radon therapy for autoimmune diseases? Cyclophosphamide, methotrexate. You know how toxic these substances are.
Maybe, well, the surprise, I think, comes from two sides. First of all, being from Belgium, we were not familiar with radon spas at all, because in Belgium it doesn't exist. So we were surprised to first be kind of delving into, well, all of the risk communication on radon and the emphasis that is being put there on being a threat to health. And then the fact that we did find out that in other countries these radon spas exist. So that's, but what was really the surprising part here is that we do seem to have these two different radon realities, and we do see that they are potentially confusing people, because we have this very large part of people who don't seem to know then what radon really is, or what its benefits are, or what its threats are. So there is a potential confusion, I would say, among the general public if you don't bring these two realities also together, and also don't upfront communicate about the fact that, yeah, okay, we might have a radon issue, but there are also these spas. And yeah, people don't really seem to know how to kind of deal with the presence of these two realities that they are confronted with, let's say.
Mm-hmm. Yeah, thank you very much for honest question and honest answer. I haven't seen any other hand risen in the audience, so let me double check if there's something substantial in the chat. No, so thank you very much for your obviously tension, and big apologies for the little delay. So let's continue as fast as we can with the moderated discussion. Thank you so much, and big thanks again.